I should send it to you so you can look in a map, but it's yeah. Anyway, I'll not say that.
Okay. Caroline was saying last week that every live starts with me saying, I think we're live. So so I'm just gonna say it again. I think we're live. Tina, maybe you can confirm, but I do think we're live. Welcome to Holistic Vet Sisters. Caroline's not here with us this week, so I get to say that. Thankfully, we've got our third sister, Tina, with us, who's in and out these days because of being in Australia, where it's crazy early when we go live. But we're very happy to have Tina here with us today. And Reagan, who's visited before from Scotland.
Hello.
Yeah, we're here to answer your questions and just generally have a chat and a cozy time. And we were just talking before we went live. Reagan was talking about seeing lots of cancer cases. I'd love to hear more about that. You've got a good relationship with your local oncologists.
Yeah, we do. We're quite lucky. It's something that I think is built up over time, and yeah, as the kind of local oncology teams see the impact that the holistic approach has on their cases, they go from being quite skeptical of what we're doing to being a bit more open to actually actively referring to us. So we do unfortunately see a lot of cases of dogs with cancer, but I think it's one of the areas where a holistic approach really does come into its own. There's a lot you can do, and you can, depending on the cancer and the stage that it's at, and what else is going on in that animal, you really can make quite a significant impact both on their quality of life and their survival time as well.
That's really interesting, and it's so important to talk about this, I think, because sometimes I certainly meet the perception that holistic medicine is the kind of feel good, minor ailments or sort of home treatments and that sort of thing. But actually it's really powerful medicine, and it can treat really serious diseases.
Yeah, yeah, absolutely. I think those chronic, those long-standing conditions, it's great for, but yeah, it really can make an impact on serious conditions. I think people are becoming more aware of things. The big one that lots of people are aware of is medicinal mushrooms, and that probably comes because there's a study that came out of Penn State University looking at dogs with a type of cancer, hemangiosarcoma, and they used turkey tail mushroom, and they showed that those dogs had significantly improved quality of life and survival time. So from that study, people have kind of become aware that's an option for the treatment of one type of cancer. But we know that there's lots of medicinal mushrooms that have immune modulating and anti-cancer properties, and that these mushrooms work synergistically. So when we use them in combination, we get this additive effect. So yes, turkey tail absolutely has its place, but there's loads more that we can do from an anti-cancer point of view for lots of other things as well with our mushrooms. But yeah, it's nice that people are becoming more and more aware of that as a treatment option.
Do you find that
I
you
think
treat
you
cancer
mentioned,
Sorry, Tina, go on.
I think you mentioned also that the oncologists keep sending back because they keep seeing good results.
Yeah, yeah. So we definitely we get a lot of animals that are already going through conventional care, so they're getting chemo or radio or surgery. We also get a selection of animals that the owners don't want to pursue conventional care for them. Usually for well, there's lots of different reasons, but yeah, there's often been experiences with humans or with previous pets, and they don't want to go down the route of that type of thing. So we have both, but it's really, really lovely that the oncologists are, yeah, actively sending their cases our way, because they see that those animals that are having that holistic approach do have, really significantly improved quality of life and survival times in many cases, which is, yeah, is lovely. It's really nice to have that kind of positive feedback and knowing that what you're doing, because sometimes you feel like you're in a bubble, don't you? You feel like you're in a bubble and you're like, okay, what I'm doing, I can see that these animals are doing well, and but you don't really know how they would have done without your care. But when you're seeing it from another clinician that's got animals that are getting that care and ones that are not, and they're saying, okay, yeah, we are seeing a significant improvement in for these animals. It's a really, really lovely feedback to get. Yeah.
And do you find that you approach cancer cases differently from other conditions?
Um, well, yes and no. Like I think the foundation of everything is a really good quality diet, and that's no different from cancer than it is for anything else. You know, with our cancer patients, where we're definitely looking to feed a kind of ketogenic diet, or at least a very low carbohydrate, kind of higher protein and fat diet, because we know that kind of 75 to 80% of all our cancer cells are carbohydrate and starch dependent. So we don't want to be feeding those carbs. We know that the quality of food is really important. If we can get animals onto really good quality fresh food diets rather than highly processed, poor quality foods, that makes a huge impact to them. And you know, we want to meet things like the omegas and the high vitamin E and vitamin C levels for antioxidants and all of those types of things. So there's a lot we want to do with diet, and that's the same for most things that most conditions that we see. And then for most cases of cancer, we'll use medicinal mushrooms. We use a lot of mistletoe as well. That's a big part of what we do for our cancer care. And then we always have an individualized treatment approach for what's going on in that animal. You know, we don't want to just focus in on cancer and forget about everything else that's going on for them, because we're looking at improving quality of life. And, you know, often case dependent, animal dependent, and these animals will go on to live for significant periods of time with cancer, and will often go on to pass away from other conditions. So we don't want to forget about everything else that's going on in there. And often we'll use our traditional Chinese medicine. So that's a very different system of medicine, and you do it based on a pattern diagnosis rather than just saying, okay, and we're treating cancer and arthritis and whatever. You build up a pattern diagnosis for that individual.
It's
What other
always the
tools do you
case.
have in your tool belt for cancer? Do you guys use like ozone therapy and stuff like that?
We don't use ozone. Do you? It'd be something that I'd be interested to, yeah, to kind of maybe learn a bit more about, but it's not a modality that we do use. Is it something you use in your practice?
I've just seen it used a lot in humans actually. And
Okay.
then I've seen a lot in some integrative practices they uses IV vitamin C and stuff like that for things like cancer.
Yeah.
And then sure, do you have any like go-to nutraceuticals that you like to give other than Chinese herbs for, well, in overall in like your toolbox for cancer patients, I guess.
Yeah, I mean the nutraceutical kind of side of things, you know, definitely things like vitamin C, but I always kind of think of that as part
The diet.
of the diet, and address it from that point of view. If we can get a lot of that met through our whole foods that are going to be more bioavailable, then great. Absolutely, some of these things it's hard to meet with whole foods to meet the kind of the levels that you need, and you yeah, we will add in supplements for sure. But yeah, I that's how my brain works, and that's how I think of it, is in with that diet part of things.
I wonder if you find, because I mean, it's obviously an important point, and I think you're making it as well, that it's never, when you treat holistically, it's never a treatment for an illness. You know, they come in with an illness, and then you treat the whole picture.
Yeah.
But I certainly find when I treat cancer cases with homeopathy that I approach them slightly differently.
Okay.
Partly, I think the biggest difference is that I tend to treat them for longer, even when they're well. You know, I'm more careful about not dropping the ball. You know,
Oh
if you
yeah.
treat someone with allergies, which is probably what I see most, and they are absolutely fine, they have no symptoms, there are no medications, then I'm quite happy to say, you know, it looks like your dog is cured now. If you ever get an issue again, come back to me. But with cancer, I'm more careful about that, because
Yeah.
if it comes back, it may be too late. So I tend to see them back often for years at regular intervals, you know, for years after they really seem cured to all intents and purposes. So I'm sort of more, it's a longer process, I suppose.
Yeah.
Not because it
Yeah.
takes longer to get them well, but just because I'm more careful about You know, the thing is, when you treat cancer conventionally, if they've had surgery, or maybe some of them have had chemo or whatever, and combined with homeopathy, they seem well. My thought is always, my concern is always that we've addressed the cancer, but we haven't necessarily addressed the imbalance in the animal that made them need to make that cancer, you know, isolate that malignancy in the first place. And if they do it again, it may be too late. So I tend to monitor them much more closely for much longer, I suppose. I wonder if you do you think, do you
Yeah,
am I making sense?
yeah, no, I totally agree. It is one of the kind of conditions, if you like, that we have, that those animals on lifelong care,
Yeah,
under a
that's
care and
exactly what,
lifelong
yeah.
treatment. Yeah, we don't ever kind of drop the ball or discharge
No.
them from care. That, and maybe some of our immune mediated diseases I would be more cautious to stop things altogether. But yeah, definitely you want to be quite regularly, you know, even when they're doing very well, even if that's on a 3 or 6 month basis, you don't want to, yeah, to
No,
stop
you don't
them.
want to just send them away and say, you know, get back in touch if you relapse, because that's,
Yeah,
you know, you want to be in the room and have the conversation and look for little signs that there may be something that could be addressed before it becomes more serious.
yeah, definitely. And it's I mean, I'd be interested to hear from you guys if, like, we're definitely seeing younger and younger animals with cancer. It seems to be all the time that the animals are younger, that we're getting through, and actually seeing patients with multiple different types of cancer has
Yeah,
become quite
yeah.
common, which is, yeah, it's quite concerning, really, the pattern that, yeah, the way things are moving, with it.
I
Yeah, I
find that
think
with
they
the
just
autoimmune diseases as well, that they come in so young. I mean, not
Yeah,
fully grown sometimes, with life-threatening autoimmune diseases.
yeah, yeah,
Sorry, Tina, I
yeah,
interrupted.
I feel like it's the burden of all the toxins that we just put into our environment, that we put into their food, all the stresses that we put on them, vaccinating more and more. And then now over time, it's just been too much. And then we're starting to see the results of it. It's the same as to do in humans. I work quite a bit with wildlife, and then I see, we don't see these chronic stuff usually in wildlife. Yes, also because well, we mostly see them when they're ill. But I think it's more an overall that we're living in a natural lifestyle
yeah.
more than anything.
Yeah, it's interesting. And yeah, the other thing that I've seen lots of this week, and we see lots of generally, are dogs with gastrointestinal issues. We see loads and loads of dogs with GI issues, quite severe, with just the really not tolerating much at all. And again, in younger and younger animals. And you know, for me, that gut health is the foundation of health. And for those animals, if you don't get that right, they're going to go on and they're going to have skin issues and ear issues and immune-mediated disease and cancer, and all of these things are going to follow. And it's quite a worrying trend, because it's like we're already seeing more and more in younger and younger animals with cancer, and now we're getting them coming in with more and more with GI issues, and you just know that for all of the animals you're seeing, there's a whole load more out there that have got these things going on, that are not getting addressed in a holistic way, that are going to come in later, with presenting with really severe disease. And it's,
Hmm.
yeah, it's quite a lot sometimes.
And absolutely, I find this so interesting when it comes to gut health, because if you compare like dogs to other species, like for example horses, they actually rely on their microbiome to actually break down their food and give them nutrients. So when something's wrong, they get sick very fast, and they go downhill very fast. So dogs, they're built different, and they're scavengers. So they're actually designed to eat literally anything and everything and be able to break it down and take nutrients from it. And what we're seeing now is, instead of their gut microbiome being flexible as how it is actually described, and diverse, we actually see like so much gut issues. And I think that's their way of saying, hey, we have a gut microbiome too. We need some care too.
Yeah, we talked about that a little bit last week. I'd just been to a lecture where some papers were presented about the um, um, causes of that predispose you to allergies. And one of the things they were saying that was demonstrated in dogs and in humans was that if you live in the countryside, you're a lot less likely. The dirtier your environment, the less likely you are to develop allergies. And it's got to be the healthier your microbiome in your gut and on your skin, maybe. I mean, they must go together. But just the idea that allergies are more common in cities, and I didn't know that, but that's been described in humans and in dogs, that if you live in a city, you're more likely to suffer from allergies. And if you are, an only child or an only pet, and you live in a very clean flat and you live in the city, you're less healthy. It's really interesting, I think.
I wonder if there's a pollution aspect to that as well, though. Like, yes, if you're in the country, you're going to, have more mud and you're going to have more exposure to the good bacteria and the stuff that you want in there. But I wonder if that, like, yeah,
That
constant
could also play a
exposure.
part. Yeah,
Yeah,
that could
yeah,
certainly also play a part. But
yeah,
still, if you have the more siblings and the more pets in the household, the healthier the microbiome is going to be. I mean, a
Yeah.
single dog is statistically less healthy than a dog in a multi-dog household, which I think is really fascinating.
But yeah, I wonder if part of that is, our dogs are meant to live in packs, aren't they? And we more and more we isolate them and take them away from this kind of natural
Yeah, yeah, yeah.
environment. And we know that stress is one of the big things that impacts cortisol is one of the things that impact the microbiome. So perhaps some of those dogs are actually suffering from kind of chronic stress as part of that as well.
I'm sure it's I mean, this particular talk was looking at allergies, and that is, as
Okay.
we know, a multifactorial
Yes. Okay.
issue. Most chronic diseases probably are. So yeah, I'm sure all these things play a role.
Yeah.
It's
Yeah, what I do now, actually, I work for a nutraceutical company and actually get paid to spend time on PubMed. So I'm actually spending so much time doing research, which is very interesting. And there's actually like so many different studies, even in dogs, that links gut dysbiosis to a variety of different diseases like gastric issues, skin issues, anxiety and behavioral issues. It's starting to be, seen in other chronic illness as well. So yeah, I think gut health is such an important part of the picture, and if you need to treat that as well in your like tool belt as one of the things, because usually they come hand in hand as well. Do you do a lot
Yeah.
of microbiome testing, Regan?
Yeah, we do quite a bit of microbiome testing, and it's really interesting to get those results back, and some of them are quite spectacular. I actually had one fairly recently that had a healthy microbiome, and I was just like, oh my God, I've got a patient that's got a healthy microbiome. I think the owner was a little bit like, shocked at my response. But I'm like, it's actually quite rare to find.
I haven't
And
seen it yet. I
no.
haven't seen a healthy one yet.
yeah,
Was
it's
it a clinically healthy dog, or why were you testing in this
um
case? Do you
oh,
remember?
I can't remember exactly what was going on there. I'll need to look it up and get back to you on that case. But I think the only thing I can remember is being so happy that this dog had had a healthy microbiome.
It
There
exists.
must have been a reason we were testing it though. So I'd say the dog had something going on. But yeah, I need to check that out. Yeah. But yeah, no, I definitely see them going hand in hand. The anxiety, the behavioural things, and the gut issues. Absolutely. The other thing that I think, and I think people are starting to become a bit more aware of it is seizures and epilepsy. So I'd say about 95% of all of our epileptic cases have some form of gut issue going on. And actually, if you can get their gut health right, your ability to control seizures and reduce off any conventional medications and stuff is much more likely. And yeah, I think they are now doing a study, I think in Bristol. They're looking at the connection between gut health and the microbiome and seizures, which is great. But,
Like,
yeah,
that
yeah,
is great.
yeah.
Do you guys do fecal transplant, or do you work with FMT at all?
Yeah, just the capsules now. We used to do it ourselves, but actually the FMT capsules are great and really easy and make life very easy. So yeah, that's usually what we do now. Um, yeah, in the UK we now have a source because we were having to import the FMT capsules before, but now you can get them here, which is amazing. Yeah, it makes a huge difference. So yeah, do you have FMT capsules in Australia or?
I mostly worked with Europeans. So I work online, so I mostly worked with Norwegian clients. So I import my stuff
Okay.
from the UK. So sometimes
Okay.
import is a little bit of an issue with some things. FMT has gone fine, and from the US sometimes as well. But
Okay.
yeah, import of
Yeah.
that is very tricky, and I don't think we're going to be able to export that into Australia. So if there is none here, then there is no options.
Yeah, I think it's a field that's really growing very
Hmm.
quickly, and I think the availability of these things, if it's not now within the next year or two, hopefully in most places it will. Then I do think it helps. I've had quite a few patients that people have come and they've said, "We've tried FMT and it's not worked," and I think it's quite important that you do it in a specific way. You need to set up the gut for success. So if you've got a dog with a very unhappy gut environment that's really inflamed and has a lot going on in there, and you put the FMT in, the way I kind of like to describe it is it's not going to make home, it's not going to colonize in that gut because you probably have overgrowth of pathogenic bacteria. You've got all of this inflammation going on, so it's just you're just not giving it a chance. So actually, you need to heal the gut. You need to suppress that inflammation and deal with that. You need to deal with any leaky gut or anything that's going on, um, and deal with any bacterial overgrowth. And then come in with your FMT, and you're much more likely to have success. And then you need to follow up with a really good quality diet because there's no point in putting that bacteria in there if you're not going to then feed it and allow it to thrive. So it's it's a tool that's really useful. But yeah, if people have not had success with it, those might be some of the reasons why. Um,
Yeah, I think you make a really important point there because a lot of people think, oh, I need to, switch out the gut, so I'll just give some FOT. But if you do it too directly, I've seen quite a few side effects with this as
yeah,
well, mostly mild with a lot of diarrhea when you just introduce that before the terrain is kind of ready to have it, if that makes sense. So yeah, I
yeah,
think that's a very important point
yeah,
that you
yeah,
need to
definitely.
spoil the gut first before you introduce it.
Yeah.
Should we do a question?
Sure.
I'm just looking at them here. Judy asks, I put the questions on the Facebook page, but I'll just read this one aloud. Judy asks, any advice, please, on ways to help support a dog with glaucoma? She's an 8-year-old wire fox terrier, otherwise fit and well, raw fed, has been vaccinated. She has had one eye removed and the other is monitored and eye drops given, regular checks at an eye specialist. Has been told she will lose the other eye, but just wanting to stave off blindness and keep her comfortable for as long as possible.
Yeah.
8-year-old she was. What
So
what what go on.
yeah, we definitely we've treated dogs with glaucoma before. It is important to have regular checkups and I would use the eye drops in the conventional care. But there is some traditional Chinese medicine that can be used if the dog's pattern fits. So there's a formula, um, Longdan, and we use it, but it's a very particular TCM pattern. So we don't use our Chinese herbal medicine to say, okay, we're treating glaucoma. If that pattern fits, then yes, it would potentially be something to use. So there are herbal medicines that can work. But yeah, you'd want to work with a holistic vet and make sure that they would be appropriate for your dog.
Yeah,
And
when
that
I
is
heard
a
this
really
question,
important point as well. If I, sorry, just to underline that, because I get quite a few people write to me after we've done this live saying, "Oh, what was that thing you mentioned?" And someone mentioned that, and what was that remedy called? And it's a fine line because we chat and you know, we know that depending on the whole pattern fitting, the picture of that medicine, it may be relevant in that case, but it's just worth underlining that the point that Reagan was making, that it's never clear cut in holistic medicine that for this condition you take that. If it's a chronic thing, then you really should see a holistic vet, and lots of different medicines could be the right one in each case. And 10 dogs with glaucoma or 100 dogs with glaucoma are likely to need different treatments. I'm sure that's what happens in your clinic too, Reagan, isn't it? That they could, there'll be different things that will be relevant for the same condition.
Oh yeah, absolutely. Because yeah, you are treating that animal in front of you. You're not treating the glaucoma. You're treating that patient. Yes, you are treating the glaucoma, but you know, it's
Yeah,
how
yeah.
you treat it is
I guess,
yeah, very, very patient
I guess that's
dependent.
the big difference between conventional and holistic medicine, isn't it? That instead of treating the disease, we're treating the animal.
Yeah.
But so often when we talk about these things, it's all, I just find myself having this conversation almost on a daily basis, because people often want something holistic for this condition. You know, is there something holistic I can give for a heart murmur? Or is there, sure, there is, but I can't just hand it to you because it depends on the situation. And it can be a difficult one, because it is a sort of everything upside down as opposed to how we normally think about disease.
I think that word, it depends, or those words, it
Yeah.
depends, are words that I use a lot when people, how do you, it depends. Yeah. Yeah.
Every single sentence starts with those words sometimes. I think at the same time, it's the strength and the challenge of holistic medicine, because the fact that we can give such an individualized treatment, that's why we can go so deep, and we can often cure things that are otherwise incurable. But at the same time, it's the challenge. You know, you've got to find the right thing for each particular animal. So it's almost like you start completely over every time someone walks in the door. You can't say, I've treated this before, I know what to give. It's back to square one with each case. So it's the strength, but it also is the challenge. And I can certainly I can absolutely understand the temptation to want to simplify it, you know, and to kind of make it fit into a more conventional paradigm and make it easier to apply. It just loses its value when we try to do that.
Yeah. Yeah.
Absolutely. I think with the glaucoma, I think I would say the same as Reagan. The first thing that came to my mind as well was Chinese medicine. So I think overall there's a lot of different reasons for glaucoma, and it depends, you know, if anything else, other patterns that maybe people don't see are present. I think what I would focus on would be, you know, a good diet. I think she said she was on a good diet. Minimizing toxins and minimizing stressors, potentially even supporting them during stressful periods. So instead of waiting for something to go wrong, I always recommend them to get like on a good gut supplement, for example, or stress support during like stressful periods, big change in their life. If they go, I don't know, under surgery, there are different nutraceuticals you can use to support them through that process as well, to kind of minimize the chances of triggering something. And then, yeah, definitely I would find an acupuncturist that could help you as well, because I think that could help to regulate the neuroendocrine system. So yeah, I think that's a good one. And then see if the Chinese medicine they're thinking of is matching the pattern, but you need to see them to do that.
Definitely. Find a TCM acupuncturist. I think is what we're all saying there, isn't it? Another question. This was someone who got in touch today. I have a litter of puppies, now 4 weeks old. 3 of them have had dermatitis. 2 of them have cleared up with a short course of antibiotics, but not the third one, which has been put on a second course with a warning it could upset his gut permanently. Can homeopathy or probiotics help? I think the problem might possibly have been caused by the washing powder I was washing the puppy's bedding in every day. It was for sensitive skin, but had changed and had a very strong smell and some nasty ingredients when I looked them up. My vet thinks this could have caused some inflammation, which an infection then got in. It is the shortest haired puppy that is badly affected, but we are guessing. I checked all my other animals for fleas and didn't find any, but perhaps there was a flea. I've had a skin profile done and it hasn't shown up anything, no mites, etc., but the fungal results will not be back until next week. It is incredibly muddy at the moment and I have a small holding. Perhaps the mother brought something in. What do you think? What do you think, Reagan? I think this is very, for me, this is unusual. Lots of dermatitis in pups, sure, but quite severe dermatitis needing systemic antibiotics in 3-week-old pups. Um, I would consider highly unusual.
Yeah, yeah. At that age, that young, it's not
Yeah,
something that you see very commonly. Um, yeah, definitely. My first thought is, oh, yeah, a second course of antibiotics. I am starting to worry about those pups and their gut health, and you probably would want to start to address that now. At that age, what you would use at 3 weeks? I mean, probably I'd be treating the
probably.
bitch. Yeah,
Yeah, exactly. I was about to
yeah,
say that. It must be about treating her and
yeah,
what's going on with her.
yeah,
I can't help thinking, I don't know, I I mean, like the owner was saying, it's all guess, we're all guessing, everybody's guessing, because we don't know why they got this, and it doesn't sound like the mother was affected. Parasites could explain it, but I can't. I find it a little bit unlikely that a washing powder will give deep skin infections in puppies. But I don't know. I would be surprised that if I was to guess, I would say mud and a small holding. If the mother comes in very dirty and wet. And lies with the pups. If they get damp, I can imagine skin infections. I think keeping them absolutely dry, and maybe certainly drying, maybe even washing and drying the mum before she goes up to her pups, might be the way to go. I would certainly think that keeping them completely dry at all times, so that the mother isn't there wet and the bedding isn't wet, would be an important thing to be aware of. But apart from that, it does sound unusual. Also, you can often get quite far with topical treatment of even quite severe skin infections, chlorhexidine foams or washers, or I mean, if it's possible to not have to give them systemic antibiotics, that would certainly be preferable for their
I
health
think she
going forward.
Yeah, I think she shouldn't beat up herself, obviously, over, the washing powder. I
Of
find that all
course.
these things usually are multifactorial, so they might not be some of them are fine, so it might be the mix of more things. So yes, toxins and stuff can trigger stuff, but there must have been something underlying. So I find more often there's usually one that is like the runt of the litter, or maybe one that is smaller, got less colostrum, had a worse microbiome, early on. So I think there's a lot of factors, and usually it starts with their colostrum and their immunity coming out, and then mixing it with other things such as potentially that. And it depends on a lot of things like the microbiome of the mom, the environment you keep them in as well. It sounds like it's clean, using a lot of cleaners and stuff like that.
Yes.
But yeah, I think it's multifactorial, and definitely don't beat yourself up over it. Just, do better next time. Secondly, yeah, it's definitely, I have not seen it that young. Actually, the youngest pups I've seen is mostly the ones that get antibiotics early on, which is also why I was a bit concerned when they got antibiotics that early. Definitely when it comes to probiotics, most of them haven't been tested in puppies. So a lot of them says for adult dogs. Personally, I do still use biome supplements for puppies. Especially when they're at risk of these kind of things. Like if they're on antibiotics, I would still possibly consider, like in recommendation from your vet, but I would still consider a biome supplement through the antibiotics, and yeah, probably even still.
What do you think, Reagan? You're in the UK. Are there any, I don't know if, I suppose we're not in the business of mentioning specific products or companies, but she asks specifically, is there a probiotic that you would recommend? Um,
Yeah. I wonder. You'd need to think about. Yeah, I'd be thinking more about treating the bitch with a probiotic, definitely to do that. There's loads of good probiotics in the UK. I like a lot of the soil-based probiotics. They can be really helpful. So yeah, something like that. What are you feeding? What are you feeding the bitches? is her diet? Are you going to get some good bacteria in that? Do you want to feed her some fermented foods or some kefir as well? And then thinking about what you're weaning these puppies onto, if they're getting weaned onto a really good quality fresh food diet that's going to really start to support their microbiome when that time comes as well, then that's going to be important. But yeah, I think I'd agree. Some topical treatments. You don't really know what these puppies have responded to, so you need to be careful in terms of what you use and test areas. But some nice cooled herbal tea washes, even something as gentle as some calendula tea. It's quite a mild tea, but it's antibacterial, antifungal, anti-inflammatory, very, very gentle, and potentially making a strong tea with that and allowing it to cool and bathing the puppies with that might be useful. If the lesions are really hot and there's a lot of heat, then again test it to make sure it's going to agree with puppies. But some nice aloe vera gel can take some of that heat out, particularly if you keep your aloe vera gel in the fridge. It can be really helpful to really bring the heat out of things and just make them feel that little bit more comfortable. So yeah, those would be the kind of things that I'd be thinking of. Well, I wouldn't probably be thinking about giving any herbs internally to pups of that age, but treating the bitch, treating topically, would be the approach that I would take.
Yeah, no, I agree
Yeah,
completely.
it's
I think apart from just the very practical issue of making sure that there's no dampness or muddiness, making them just, yeah, damp. I think dampness could be a problem. But if we look slightly further, to me, they're right on the cusp of where you consider them individuals. They're 3-4 weeks. They're just beginning to separate from the mother. They're just beginning to eat. But I would also see them as part of that ecosystem of the mother and the pups in that situation, and focus on the mother. What's her gut health like? What's her diet? What's happening? Is there something going on that's stressing her? Is there someone, maybe is she feeling stressed having to protect the puppies because I don't know, do other dogs have access to where she is? Or just maybe see her as the patient and treat her, and then the pups will benefit as well.
There's a question here from Nicola as well. She was asking about indigenous probiotics, which I think was an interesting topic as well, because you mentioned washing them as well. And I'm also much for using topical probiotic products, which Joe sells a lot of now. So like a probiotic shampoo, they even have like probiotic floor cleaners and stuff like that. So for anyone listening, if you're still using toxic cleaners on your floor, that can have a massive impact as well. So if you can switch that out with something that is non-toxic, maybe even have probiotics. So the concept of that is that they're crowding out the bad instead of killing bacteria. You're just killing everything. It's kind of what humans do, isn't it? Killing everything. So it's a different concept, and I really like that. So you can crowd them out instead. And on the topic of probiotics as well, that's kind of what I'm doing research in. I'm doing nutraceuticals for gut health. And we're seeing a lot of promising results actually using fermentation products. So still in research, what's been researched a lot is probiotics, but now they're actually starting to wonder, what they see is that the probiotics don't always colonize or don't always colonize for a long time. So they're actually wondering, maybe it's not the actual live bacteria that does these things. Maybe it's the cell components and the parts of it. And then, probiotics can also carry the risk of things like antibiotic resistance, and also, a lot of them don't survive very well. So the packaging, transportation through the gastric acid, things like that. So there's new research that's kind of like the new on the gut health, if I can sneak in some research in there. That's kind of the new on that side, that they're using a lot of fermentation products. So there's different types of probiotics. So you got the prebiotics that feeds the good gut bacteria. You got the probiotics, which are live bacteria. You even have something in the fermentation products, which is called para probiotics, which is essentially the bacteria cell wall, but they're inactivated. And then you have the postbiotics, which are the metabolites that are produced by the bacteria. So what we essentially want from a probiotic is that they settle and then they eat the prebiotics and then they start producing postbiotics, or the metabolites metabolites that they produce that are beneficial to us, which includes things like bioactive peptides, vitamins, short chain fatty acids that work directly on the gut. And so yeah, what they've started to do now in a lot of supplements, not that common in Europe yet, from what I can see, is that instead of giving them probiotics and hoping that they survive and make it and will make these beneficial metabolites, they're providing a fermentation product. So essentially like fermented, for example, bacteria. So you get the beneficial metabolites directly, and they're much more stable as well. So I was also thinking for this case, if that actually is a thing that you can find in the UK. I'm not 100% sure. Haven't been there for a while. Then that could be beneficial as well. I don't know. Is that something you have?
You could feed fermented foods.
That too. But yeah, if I find it like sometimes difficult with flavors, and also you don't know what strains are in there, so you could also purchase directly, for example, from Saccharomyces yeast or something like that, or spore forming bacteria. What were
There
you going to
is
say?
one product that I think it is fermented, and the name will hopefully come back to me before we finish this. If it doesn't, I'll need to send it in to you. But there is a product. It's a liquid. Yes, I will make a note to try to remember that.
Thank you.
Because that can be kind of like a safe way to do it also if you have young puppies and things haven't been studied very well in puppies, to use the fermentation product, because then you're kind of just adding the metabolites directly and not necessarily leaning on having to have the live probiotics that can be triggering to some as well. So yeah, that's what I'm nerding about.
I think the more I think about it, the more I'm interested in hearing about this, the mother of these pups. You know, what's her health like, and what's her gut health, her diet, and what happened to her a week or two ago. You know, what stressed her out.
I think you should
Interesting
book a
story.
consult with Lisa.
I know. I want to know more.
Yeah.
Yeah, feel free if you're listening live, and if you're not listening live, then feel free to send us more information anyway, and we'd love to hear what happens and suggest things to do if we can. We have one more question, which is actually one that's carried over for several weeks. Trina asked a while ago about the best time to give a dog a rabies vaccine. And I think it came from hearing a TCM. I'm not sure who, but she remember that it was a longer question, and she said she'd heard someone talk about seasonal influences, and that there was a time of year that it was best to give a vaccine, I think. That's not how I think, and I wouldn't say that. I don't know if I mean you're both. Yeah, go on.
Yeah, no, there's actually, especially if you got an intact female, that is a very important question. I made a video on this earlier, actually, because you know, when you have your period, you will have times of your cycle where you're more prone to getting, you know, cold sores or catching a cold. So that's actually a really good question, because we actually have listeners that have intact, you know, females. So males generally have like an overall flat hormonal curve. So in males, it doesn't really make a big difference. But if you have a female, you will have up towards actually the time after she had or when she's right after she ovulates is when the body is switching its T cell response to not attack mode. So if you have a sperm and you want to get pregnant, you want to not attack that sperm. So you have a window there which they're more prone to getting side effects from that vaccine. So I always recommend to intact bitches to do it in anestrus, because that's like their safe window when the hormones are level and they're well protected by their immune system. So that's an awesome question, actually, in sense of hormonal cycle. I'm sure there's more context to this question, but yeah.
I think the question was in terms of seasons of the year. Is there anything in Chinese medicine that you recognize in that it's better to vaccinate in spring or in autumn or no? I'm the only one here who doesn't have a training in traditional Chinese medicine, so I'm not saying anything. But I think this was the point that was made. But I don't know whether it's a generally accepted one or even a valid one. I would say about when to give a rabies vaccine. The first flippant answer would be ideally never. You know, if you don't live in a place where you have to, don't. And if you do it because you want to take your dog on holiday, I would urge anyone to really, really rethink whether it's not possible to leave the dog at home. But if that's not an option and you have to give a rabies vaccine, that my advice would be to make sure that the rabies vaccine is given alone, that it's not giving as part of a cocktail with other vaccines. We know that adverse effects after vaccination happen much more commonly when vaccines are lumped together. So make sure that no other vaccines are given at the same time. Make sure that your dog is really healthy. Like Tina said, don't give it in times of hormonal, big hormonal changes. And then I would always give the homeopathic remedy Thuya around the time of a vaccination. But I've not got any experience or even heard before that the time of year should be significant.
Yeah, so I guess the answer to this question is, again, it depends. It
Yeah.
depends on where you live. Because like we live in Scandinavia, we don't have rabies. So if you live here, then you probably don't need it unless you're going traveling. And as Lisa said, ideally you want to avoid it. So if you can keep them at home somehow, then that's more ideal. If you have to take it, so we're actually pretty good at this in Norway. I'm sorry, the frog is very loud outside.
That's a great sentence. I'm not...
So loud. So if you have to take it, our principles in Norway is generally waiting, as long as possible. So if they're fully grown and their immune system is, done developing, that's ideal. And we also do, like Lisa says, like in Norway, we don't give everything at once. It's just a principle that we never give rabies vaccines with other vaccinations. I remember when I was in America and we were like, yeah, we give like, was it rabies right rare or something like that. And then they give vaccines on different sites. So if there's a swelling or something, they will see, and they just put so many vaccines all at once. It's just ridiculous. So that would be my one tip. Yeah, don't give it away from other vaccines and give it when they're healthy, when they're not in hormonal changes. And when thinking about seasons, obviously in Chinese medicine, seasons can affect, they can kind of attack them as well in some ways. So if you have seasons where it's extremely hot or extremely damp or it's changing really fast, then their immune system can get a bit of a hit as well if it's like super windy. But again, it's a bit hard to plan around this. So I would just try to do it when the season is stable. I don't know if you have any other opinion on that, Reagan.
Yeah, I don't know that we get a stable season here. So you can do it based on that, but yeah, always just wet. Yeah, no, I think what you guys have said kind of covers it. I don't know that there's much more to say than that. I think if you definitely see seasonal patterns emerging in terms of what's more likely. You have times of year where you're more likely to see certain skin diseases and eye issues, and if you've got a dog that's got some of that going on, and you know that they're likely to have a challenging season, then potentially avoiding that. But yeah, yeah.
I think one thing I would add with the rabies vaccine is to look for a thimerosal-free one. So one without mercury. It's an adjuvant.
Is there? I'm sure I know this, but I've gone blank. Is there rabies in Australia? Surely not.
No, actually, well, I think they have it in the bat population still, but
Oh,
it's not
really?
common. So we mostly, I think if you work with wildlife and stuff, you need the vaccine because the bats can have it. But it's generally not that common.
So it's not routinely given to dogs.
No,
Good.
I don't think so, actually. I only worked for a couple of weeks here, so I'm actually not sure. Mostly with koalas.
Sure, because of course there are regional differences, and in some places I was, had a consultation today with a dog in Turkey, and they have to, apparently by law, they have to give rabies every year. So
That's
sometimes
actually,
it's not an option.
yeah, that's one thing that I think is so odd. Like I understand obviously it's a very zoonotic and dangerous disease, but what I don't understand is why they don't accept titers. So like when you give a vaccine, there is no guarantee that they actually
Mm.
respond to that vaccine. You don't really know unless you're testing for it. But then the rules usually say you need to vaccinate. It doesn't say anything about doing a titer test, which I think is more viable because then you can actually check, is there an immune response or is there not? And instead of testing and knowing, okay, he's fine, he's covered, they just give more and more. And like there's no rules around like testing it. They just blanket prescribes it for everyone.
Yeah, it's really unfortunate, and it's so difficult for people living in regions where there's rules about this, and you just have to give them. You have to give the vaccines, and you know that you're harming your dog, and you have to keep repeating them. It's been a big issue in the States, and I think some areas have changed their legislation in the last few years so that it is possible in some places to not have to repeat rabies just to all dogs. But it must be really stressful if you live in a place where that's what you have to do.
But yeah, as you say, using your homeopathic thuja and doing detox and using milk thistle and doing what you can to support the detox process afterwards is really all you can do. If you have to give it, then yeah.
Absolutely.
Yeah.
And that's a really important. Sorry, say that again, Tina.
And make sure about the adjuvant.
Yeah.
If you can, but I think it's a really good general point that health and damage to health isn't about one thing. There's a big picture, and if one thing is inevitable, or if one thing has gone wrong, like I have this conversation a lot about people who've neutered, and now we know how harmful that is, and what are you going to do? It doesn't mean that everything is lost. It just means that there's all the more reason to look at diet and avoiding toxins and vaccinate carefully and all these other things that you can do to enhance their health. And similarly, if you have to vaccinate them against rabies, then pay extra attention to all the other things that you can do to make up for it, hopefully, and still have a healthy animal.
Yeah, one thing that I would encourage our listeners to do is, usually as holistic practitioners, we get the animals when it's already everything's falling apart and they've had issues for years and years and years. Honestly, you don't necessarily need to have a super sick pet to come and see us and come and have a chat about what you can do better, because the best way to avoid it is preventing it from happening. So I really wish people would come in sooner. Like when you have a puppy, just talking to us, like what can I do? What should I feed? And then have us on board so that if something happens later as well, we can actually, we have the full history and we have a good base. Because really what I see is, when they come really late in life, like, yes, we can manage symptoms, but it's really hard sometimes to cure a disease that has been there for a really long time. When they come in as puppies or very young and they have an issue, normally small changes can be enough to set them up for life. So I get so many young animals with, for example, early allergies. We switch their diet to a fresh or raw food diet, and then they're good. So please come and see us early. Don't wait until everything's falling apart to see us. It works a lot better if you come in sooner.
Do you get those, Reagan? Do you get the healthy pup consultations? And how can we set this one up? I find it's often when someone has been through a lot of chronic illness with a previous pet, and they just want to do it better this time.
Yeah, we definitely get them, and I love them. They make me so happy just to really get them off to the best start, to get all of that right, to be discussing vaccinations and flea and worming and diet and everything that you can do to really set them up for success. And yeah, I absolutely agree with you. It's often actually been owners that we've treated their dogs before, and they come back with a new puppy, and it fills me with joy to do that.
Yeah. I think that's something that takes up more and more of my practice, but also just of my, I don't know, the way you think about health, that shift from patching up things when they've gone terribly wrong over a really long time to, how did they get there, and what can we do to try to prevent them from getting there? And sometimes the heartbreaking thing is that a lot of the stuff that the owners have done out of from the best intentions quite often have contributed to a decline, which is, we'd like to do better from the outset when we can.
Yeah, but also to say that not to beat yourself up, because we do see people that do everything right and they still end up with animals with conditions and disease, and you can't control everything. All you can do is put as many pieces of that puzzle in place that sets you up for the best chance of success. But if it goes wrong, not to be too hard on yourself. And
no, that's a good point too. A huge part of health is genetics and chance. You know, we don't understand everything and we don't control everything.
No,
Um,
and the environment around you has a massive impact, and you can't control that. You know, in terms of yes, you can select better quality foods, and if you can get organic, amazing, and you can be aware of the water. But you know, if you're living in the city and you've got air pollution, there's not a lot you can do to control that. You can have air purifiers at home, and you can do that kind of thing, but not everything is within your control. So it's managing as much as you possibly can.
yeah.
Absolutely.
Yeah.
That's very true. And also just that we tend to, well, I find a lot of us, it's easy to think that if you've done things in one way and it went well, then clearly you've proven that that's a good way to do things. You know, it's easy to get a skewed view of things if you're a pet owner with 1 or 2 or 3 or, you know, say 5 dogs through your life, or even if you're a vet in a small practice. You know, it's really interesting when we look at statistics and, you know, blinded trials and much bigger numbers, the factors that affect health that we don't necessarily see ourselves. So just because we had one dog and we did one thing and it went poorly or it went well, doesn't necessarily say that we can, you know, mean that we can say, in my experience, this is the best way to raise a dog, or this is the wrong way to raise a dog. And as a consequence of that, you know, lots of neutered dogs are healthy. If you can only feed kibble, it doesn't mean your dog is going to be horribly sick. You know, there's lots of things that we can get away with in many situations as well. It's not clear cut, and few diseases are caused by one mistake that is made. There's always something we can do to help, and there's never any guarantees. But we
Every
keep
individual.
absolutely, yeah,
And
we
if
keep learning.
exactly. And if someone's sitting here thinking now, oh, but I don't have the access to, you know, holistic vet, I do want to emphasize as well that most of us work online. So that's a way to go as well. Just contact us even when they're still young, just to have a chat, you know, what should I feed? How, should I do these vaccines? Just to have that good start in life, and then we can follow you throughout life as well, not just trying to patch up the emergencies that are tricky later on as well. So yeah, we do work online if you look.
I certainly found about having worked both in Denmark and in the UK for a long time, I found 15-20 years ago, that was one of the biggest differences, that the dogs that were the animals that were brought to me in Denmark were terminally ill. You know, it was like the absolute last result. We're desperate, we're coming to you. Whereas in the UK, even 15 years ago, 20 years ago, it was much more common for someone to show up with a dog saying there's nothing wrong with him, but we're all having our MOTs this month and we just want to find out, you know, what will be a good remedy, or what would you change, or how can we preserve health? And that always really struck me as a very constructive and progressive way to look at health. But these days I see it much more commonly everywhere, really, that this, I think, social media, and there's lots of talk of health. Everybody's talking about the microbiome and about staying healthy. So there's much more awareness, which is really encouraging.
Yeah, we definitely still get both. We definitely get the young ones coming through, and those preventative approaches. We definitely get the you are our last chance. We've tried everything else now. You need to fix it, and we get both for sure.
Yeah.
Yeah.
And they're also really rewarding. I mean, they
Yeah.
are very often some of the most rewarding cases, because
Yeah.
then you turn them around and they go well, and the euthanasia is cancelled, and you know, it's not a bad starting point to be told that this is hopeless.
No.
And
Yeah.
very often with
Sorry.
very often with different tools, it's not hopeless. Yeah.
Yeah, absolutely. A little bit of pressure, but you know, nothing wrong with a little bit of pressure to get.
Thank you. We are out of time. Get up early again soon, Tina. We want you back. You can go back to bed now, but come back soon.
I will.
And you too, Reagan. Thank you so much for being with us. And let me know when you're free on another Thursday, and we'll book you in again. We'd love to have you.
Yeah, no,
Thank you.
thanks for having me. It's been lovely to
Thank
do
you very much for being here.